Hello, everyone. I'm Associate Professor Paula O'Brien from the Melbourne Law School. I'm very pleased to be presenting this short lecture on controlling the information environment for alcohol, the regulation of alcohol marketing, labelling and packaging. I'd like to start by acknowledging the Wurundjeri people of the Kulin Nation as the lands on which the University of Melbourne, my home institution, stands, and pay my sincere respects to their elders past, present and emerging, and I acknowledge that their land was never ceded. In this presentation today, I'm going to reflect on the recent regulatory change that occurred in Australia about the pregnancy and alcohol warning labels. And I'm going to reflect on how this regulatory change was achieved, who and what was important to making this change happen, and what's needed now to make this new regulation work to inform consumers, change behaviour and reduce alcohol-related harm. I'm also going to finish by discussing the implications of this labelling reform for future policy intervention around alcohol labelling in Australia. So let me start by showing you the alcohol and pregnancy label that Australia has introduced. So in 2018, the Australia and New Zealand, as part of their joint food labelling standard system, decided to mandate alcohol and pregnancy warning labels. The final form of the labelling standard was approved in July 2020, and that standard required that from 31 August 2023, or I should say 1 August 2023, all containers or cartons of alcohol placed on the shelves for sale in Australia must be packaged and labelled with this warning about alcohol consumption and pregnancy. Containers packaged or labelled before 1 August, or right up till midnight on the 31st of July 2023, do not need to bear this new label, and they do not need to be relabelled, that means. The label seeks to provide information about the risks of drinking during pregnancy so as to avoid the permanent harm to the fetus and the person to be born in the form of fetal alcohol spectrum disorder, or FASD, which is thought to be running at about 5% in the Australian community. As you'll see on the screen, the label consists of a statement with a signal phrase, pregnancy warning, the text, alcohol can cause lifelong harm to your baby, and the well-known pictogram, or in the case of very small bottles of alcohol, just the pictogram is required. The alcohol pregnancy labels are required to meet certain presentation requirements in terms of the fonts and colours that you saw on the previous slide, as well as certain minimum sizing, which is actually quite small. There's no requirement set down in the regulation as to the position of the label on the container, although it must be legible and prominent. The pregnancy and alcohol warning label is the only alcohol health warning required by Australia and New Zealand on containers. Australia and New Zealand do also require alcohol content, standard drinks information, and basic allergen information. But there's generally been very little done by Australia and New Zealand to regulate the labelling of alcohol. The alcohol industry has been given great freedom to use the label space as they see fit, with the effect that the label and the packaging provide exceptional promotional opportunities for the alcohol industry. And although the new pregnancy and alcohol label is far from perfect, it still seems quite remarkable to me that Australia and New Zealand finally decided to mandate pregnancy warnings in 2018 and approve a new standard in 2020. So how did Australia and New Zealand get there? Well, to start with, there was great patience and persistence needed to get this policy change through. It didn't happen overnight, and it was not straightforward. There were many failed attempts, we could say, very long timelines and major challenges thrown up every step of the way. Australia and New Zealand have a very complicated food standard setting system, and they make food standards through a joint technical regulator called Food Standards Australia and New Zealand, whose proposed standards are subject to final political approval by a joint, what is now called Food Ministers Meeting. And the Food Ministers Meeting consists of the food ministers, but sometimes other ministers of the government of New Zealand and the government of Australia, the Commonwealth, the 6 states, and the 2 territories in Australia. Now, according to my research, the very first proposal for pregnancy labelling was put to the food regulator, Food Standards Australia, New Zealand, in 1996, followed by a second proposal in 1998, then a third proposal in 2006. And then in 2008, a referral to Food Standards Australia, New Zealand from the Food Ministers Meeting. In the past, the Food Ministers Meeting was called different names, so the Ministerial Forum on Food Regulation, but it's now the Food Ministers Meeting. None of these proposals or the referral were accepted by Food Standards Australia and New Zealand, but from 2006, when the third proposal was received, the SAN started to conduct more in-depth research and technical assessments of the alcohol and pregnancy labelling proposals. Then in 2011, there was a turning point, I think we'd say. And remember, this is 15 years after the first proposal for SANs in 1996. And it's still 7 years before Australia and New Zealand finally agreed to mandate pregnancy and warning labels in 2018. But 2011 is certainly a turning point. A seminal intergovernmental inquiry was conducted, which produced a report in January 2011 entitled Labelling Logic. And the report was about food labelling, and not just alcohol labelling, so the food system more broadly. And it recommended that a warning message about the risks of consuming alcohol while pregnant be mandated on individual containers of alcoholic beverages and at the point of sale for unpackaged alcoholic beverages as support for ongoing broader community education. Now, this recommendation from the Labelling Logic report for mandatory pregnancy warnings leads to my next reflection from the Australian experience, and that is about the benefit of extracting policy promises to which government and/or industries can be held accountable. In this case, the Food Ministers Meeting had to issue a formal response to the Labelling Logic report. And in December 2011, in relation to the mandatory pregnancy warning label recommendation, the Food Ministers Meeting stated that it was giving the alcohol industry 2 years to introduce pregnancy warning through an industry self-regulatory scheme. The scheme was being operated by Drinkwise, an Australian alcohol industry funded organisation. This was effectively a deadline of December 2013 for the industry to introduce the labels. This was a soft target that turned out to be a very useful advocacy point, as the target was ultimately not met. Similarly, Drinkwise itself had made a public promise that it would have 100% coverage of alcohol products with pregnancy warning labels by an earlier date of July 2013. Now, the fact that the five or more years elapsed from these 2 missed deadlines to when the Food Ministers Forum mandated the label shows that making and breaking policy promises was not enough on its own to get the labels mandated, but it was an important part of the strategy ultimately for achieving the labels. So this brings me to the question of proof. Proving that the labels were needed, they would make a difference, they were feasible, and that the government needed to mandate them rather than the industry running a self-regulatory scheme. So the proof that was persuasive during this campaign to change policy was a mix of academic, peer-reviewed research and high quality, but not necessarily peer-reviewed research coming out of non-government organisations, coming out of government. So some papers that were important are listed there on this slide and the next, but there was data from 2018 about Australian women's use of alcohol during pregnancy, which was running at that time at about 35.6% overall, and 14.6% of respondents continued to drink after becoming aware that they were pregnant. And that came from a report commissioned by the Foundation for Alcohol Research and Education, Australia's leading public health alcohol NGO. There was also focus group data from 2018 about how women understood the messaging and design of the DrinkWise self-regulatory labels and pointing out the deficiencies of the DrinkWise scheme. One example was the DrinkWise labels that I showed on the previous slide. Let's take you back. In both the 2011 and 2016 iteration used the phrase, "It's safest not to drink during pregnancy," which was found in the study to be interpreted by women to mean that it was safe to drink some amounts during pregnancy, but the very safest, maybe the over-the-top position, was to not drink, which is not a correct message in terms of the evidence. There was also data on the extent of the use of the DrinkWise labels on Australian packaging. And this data came from a number of sources, and a particularly persuasive source were two reports that were commissioned by government itself to track how well the industry scheme was working. By 2017, May 2017, so the last report that's mentioned on the slide there, which was several years after the industry's deadline for including the messages, there was still only about 49%, in fact 47.8% of products bearing pregnancy warning labels. Many of the warning labels were also found to be very small, no bigger than a quote P. But if you think that the industry would just roll over at this point in 2017, or that the Australian and New Zealand governments would not hesitate to regulate at this point, you are wrong. Private interest fought against the label all the way, and the alcohol industry used all kinds of avenues to try and stymie the introduction of the label. At a very important inquiry into FASD in 2012, the industry, for example, made unfounded claims in submissions that introducing pregnancy and alcohol warnings would lead to more abortions. As late as 2018, the industry obfuscated about the links between alcohol and FASD in public education materials, stating, quote, "It's not known if alcohol is safe to drink when you are pregnant." And this campaign by the industry, that was in the form of posters to be placed around the community, is well examined in this article by Julian Coughlin in the Conversation. In 2018, the Brewers of Australia, the peak industry group for brewers, told the Commonwealth Government that there's no shortage of health and nutritional information for consumers. Through mobile devices, consumers can scan barcodes or QR codes to have all the information they ever want literally at their fingertips. The label is simply outdated. And then even after the Food Ministers Forum had decided to mandate pregnancy warning labels in July 2018, the industry fought very hard to influence the design, the content and the design of the label. It did have some success with its advocacy, particularly in the change of the signal word in the draft from health warning to the final form of the warning, where it says pregnancy warning. And the significance of this is that if the warning message is seen as a health warning, it relates to the whole population, whereas a pregnancy warning signals that this is a warning that pertains only to a small group of people for a small portion potentially for a small portion of their lives. So this leads me to the politics. The politics were very difficult in this whole process of getting the pregnancy warning. There were strong political currents pushing against the labels all the way to the very end. And there were politicians who lobbied hard for the industry's interests, and there were arguably, but not exclusively, gendered aspects to these politics. At the same time, there were politicians from different political parties who supported and advocated for the labels, even though the party's position was not favourable to the labels. And the creation of this cross-party support was exceptionally important to getting the final result. But there's no doubt that the labels would never have come about if Australia's leading alcohol NGO, the Foundation for Alcohol Research and Education, had not been so capable and determined and active in its campaigning. But there's also no doubt in my mind that FARE would not have been so successful if it had acted on its own, and it worked very hard to build partnerships with many organisations who supported the labels. It joined with FASD organisations, disability organisations, public health organisations, medical organisations, Indigenous and First Nations groups, academics, and it worked very closely and constructively with the regulator. The NGOs encouraged people to make submissions and sign petitions, and the NGOs talked to politicians, they commissioned good research, and they stayed the course to the very end. So the labels came into effect just a few months ago after what could be seen as a 23-year process, starting with the very first proposal back in 1996. So the task is now to see the alcohol and pregnancy warning label implemented. I'm involved with a group of collaborators led by Professor Simone Pettigrew in the creation of an alcohol industry monitoring system in Australia that will, amongst other things, gather the data to track and report on the implementation of the pregnancy and alcohol warning label. Our project has just recently commenced, so it's good timing for studying whether the industry is implementing the label as now required. The project involves taking photos and gathering data from actual containers of alcohol in bottle shops. And one of the pieces of information that will be gathered is around the pregnancy warning label, as you can see on the screen. So what are the prospects for more alcohol labelling and packaging regulatory reform in the near future in Australia? Well, the Australian government, through the Member of Parliament, Jed Kearney, the Assistant Minister for Health and Aged Care, stated in November 2023, the Australian government recognises the importance of labelling to raise consumer awareness of and seek to prevent alcohol-related harm. And she also said she's seeking advice from her department about, quote, options for raising consumer awareness on the harms associated with alcohol. There is current advocacy by various public health and medical NGOs and community members for labels that refer to the risks of liver disease, mental illness, and cancer from alcohol consumption. And a recent poll by FARE found a very high level of support for more labels on more health information labelling on alcohol, 78% of those surveyed. So Australia introducing more health information on alcohol containers, maybe in rotation, messages in rotation, as we have with tobacco warnings. That is done for reasons of space, because you can't have all the different messages about all the different risks from alcohol, maybe on one label, but also to avoid consumer fatigue. This kind of measure is certainly supported by the WHO. It's in the WHO Action Plan on Alcohol for 2022 to 2030. It was also endorsed in January 2023 by the Executive Board of the WHO as a very cost-effective policy option for controlling non-communicable diseases. So the WHO is trying to encourage member states to move towards better labelling of alcohol containers. But at the same time, Australia has shown concerns in international forums about more alcohol labelling. As described in the paper by my colleague, Associate Professor Deborah Gleeson from La Trobe University, Australia is one of the members of the World Trade Organization who's raising queries and expressing some opposing views to Ireland's new alcohol health warning that includes a warning about the direct link between alcohol and fatal cancers. So the Australian government has some policy decisions to make about pursuing good public health measures at home, such as improved health information on alcohol containers, and also about supporting other countries like Ireland to do the same. Thank you very much for listening.